My name is SudhaJaganathan. I'm an MD. I am a cardiologist and I specialize in advanced heart failure and transplant cardiology. I'm with UNC Cardiology here at Nash. We're affiliated with UNC, so I also work at the Medical Center in Chapel Hill. That's where I do more of the advanced heart failure, transplant, mechanical circulatory support for advanced heart failure patients. Here at Nash, I run the heart failure clinic along with my nurse practitioner, Erica Mountjoy. We also run the IV diuresis clinic and administer IV diuretics to patients that are very short of breath or have a lot of fluid on them. Cardiology has kind of been a calling since I was a kid. My dad was a cardiologist and kind of following in my dad's footsteps, but during my rebellious years, I wanted to pursue other specialties, but cardiology was always a calling, and heart failure more so. My father has heart failure, my mother has pulmonary hypertension, so it just seemed like the right field to go into. It was the one that I was most interested in cardiology as well. I was born and raised here in the US, and I actually went to medical school in India, and that was just more so to kind of get more familiar with the culture and just a different aspect in medicine too. Came back and did my residency in Dayton, Ohio. I also worked as a hospitalist for 6 years before going into fellowship. And I pursued cardiology fellowship in Cincinnati, Ohio, at University of Cincinnati. I had done a heart failure year before going into general cardiology, so 4 years of fellowship up in University of Cincinnati, and then came down to North Carolina at UNC Chapel Hill to pursue my last and final year of training in advanced heart failure and transplant. For our patients, it's very difficult to travel to the other cities, to the bigger medical centers, and providing heart failure care locally for them is an advantage too. We're able to see them frequently, we're able to remotely follow them and do telephone follow-up too to make sure that they stay in good health. And at the earliest signs that things aren't going well, we're able to intervene.